First of all, I would like to sincerely thank the organizer of this event for this opportunity, and in particular Professor Carraro, who also collaborated in this presentation. And today I will present a particular approach of full body in bed exercises that has been developed by Professor Carraro in order to promote active aging and maintain muscle function over the years in a safe and effective way. So, before presenting the research we are now conducting with Professor Carraro on this protocol, I would like to briefly introduce why it's so important nowadays to talk about and focus on active aging. We have seen before that there is in our days an increased life expectancies that is mainly related with the progress in medicine. But this increase in life expectancies is also related to an increased need of rehabilitation worldwide. And so these are the numbers. An increasing number of people worldwide are requiring rehabilitative intervention, with around 400 million people in Europe requiring some form of rehabilitation during their life, and of these, more than 125 million people are over 65 years old, thus underline the need for new strategies to improve healthy aging. Oops. Okay. And so this is mainly related, as I already said, to the increased life expectancies related to medicine progress. But living longer is not always associated with living healthier, since as people age, they may experience some multiple conditions, frailty, and progressive functional decline. And therefore, increased life expectancy often translates in more years lived with some diseases or some disabilities. Moreover, as people age, they often experience physical inactivity, and this inactivity has been related by several research to further functional decline. In particular, physical inactivity has been related to a reduction in muscle mass, which can drop by 1 kilogram in 10 days of physical inactivity, but also physical inactivity is associated with some cardiovascular and respiratory function performance reduction, in particular with elderly subjects experiencing 2 weeks of bed rest, reporting a reduction in their maximal oxygen uptake of around the 50%, as well as a reduction in their muscle performance and strength. In addition, recently, physical inactivity in the elderly has also been associated with increased level of pain perceived. And this is a study recently published in which the authors considered the association between different lifestyle factors and pain levels. And what they have found has been that older subjects coming from different parts of Europe report higher level of pain when they present lower levels of physical activity. And this is really important, since pain is one of the most common reasons why people require some rehabilitative care. Nevertheless, we have an important instrument to try to break this vicious cycle between physical inactivity and rehabilitative care increased demand. And this instrument is regular exercise, as we have already said before in the previous presentation. Regular exercise has been demonstrated by several studies to have a big role in reducing the risk of death from different causes, and in particular cardiovascular and respiratory causes. But also being engaged in regular exercise can have a role in extending the health span of people, acting on some important aging pathways related to inflammation, that can be reduced through regular exercise, related also to insulin sensitivity that can be improved by regular exercise, and also related to mitochondrial function. And all these pathways are generally worsened by physical inactivity. So with exercise, we can act to try to reverse these mechanisms. And this is the graph that represents what normally happens when we age. So while we are aging, we have a decrease in our physiological reserve, and therefore an increase in vulnerability, frailty, and eventually disability. But physical activity can change this graph, in particular slowing this process, and therefore preserving functional capacity and shifting the threshold for disability and frailty to later stages. This is certainly true for people involved in high level of physical activity. And this is a striking example. Joan Lopez Garcia, an 82 years old ultramarathon world record holder that was recently studied, reporting an exceptional respiratory performance comparable to that of healthy subjects of 20 to 30 years. But what about the typical older adult, so a no-master athlete? Also, in the typical older adult, we should recommend to be involved in a program of physical exercise, since physical exercise in older adults has demonstrated to have a role in maintaining function and reducing disabilities in the future. And in particular, a multi-component program involving resistance training, aerobic, and balance training has been demonstrated to have to be able to maintain function and therefore to reduce the need of future rehabilitative care. And based on this premise, Professor Carraro developed the full body in bed gym protocol, which is a short daily routine of 15 to 30 minutes in which strength, aerobic, and balance training are combined, involving all the different regions of the body. The full body in bed gym protocol requires only body weight with no special equipment needed, and its low impact nature ensures safety and high tolerance in elderly subjects. The full body in bed gym protocol follows an incremental daily program. In the first development phase, the number of repetitions was progressively increased for a limited subset of exercises. But now we have decided to increase the number of exercise, and each exercise is performed 10 times, so it's repeated 10 times every day. And so now we have reached a total number of exercises inside the protocol of 15 dynamic and isometric movements performed in different positions, starting while lying on the bed, then sitting, standing, and in the floor push-up position. The full body in bed gym can act both as a bridge after rehabilitation, so in order to promote long-term maintenance of function, but also has a preventive strategy. It is particularly suitable for individuals with limited mobility and frail older adults in order to maintain function, but it can also be performed by healthy older adults in order to preserve fitness, muscle mass, and aerobic capacity. And finally, but most importantly, it can be also performed by older adults with common comorbidities. And this is really important since even in presence of chronic conditions that often occurs in older subjects, we can have a good instrument to treat and to maintain function. And this is why during the pandemic, this kind of home-based protocol has seen a great dissemination, since due to the mobility restriction of the pandemic, we needed some instruments to try to treat frail people at home. And so we employed the full body in bed gym protocol, seeing some positive results. And to talk about the positive effects of the full body in bed gym, I would like to start by presenting as a case testimonial Professor Carraro himself, so the developer of this protocol. Despite his complex medical history, including a previous severe polytrauma and cardiovascular disease, his long-term adherence to this protocol allowed him to maintain good function over the years. So he started in 2013 to perform the full body in bed gym protocol, and now he has reached 50 exercises performed every day for a total of 30 to 35 minutes per day. The adherence to this protocol has determined some positive effects, as I've said, involving the rise in the muscle strength and the possibility to continue to perform demanding daily activities. Moreover, 3 years ago, we performed a computed tomography analysis in which we have found that when analyzing the leg muscles, we have seen a preservation and even an hypertrophic effects on some muscles. And when evaluating the fat infiltration, we have seen that it was reduced compared to a population of age and sex-matched controls. More recently, we also performed an ultrasound evaluation in which we have found an increased thickness on the left side of the legs, and in particular of the soleus muscle. And this is interesting since in the last 2 years, Professor Carraro performed more exercises on the left side in order to increase the hypertrophic effects of this kind of exercise. And so ultrasound seems to suggest that this kind of exercise can have a true effect, hypertrophic effect. So now Professor Carraro has started to integrate the full body in bed gym protocol also to a dietary approach involving the so-called time restricting eating protocol, in which daily food intake is limited to a defined window. This kind of dietary approach has demonstrated to have an effect on metabolic regulation, stimulating autophagy and reducing inflammation. But this kind of dietary approach was adapted to the Mediterranean diet, so determining the so-called free no strategies with no bread assumption, no wine, and no dinner. Combining this dietary approach with the physical exercise of the full body in bed gym protocol, some positive effects on body composition can be shown, in particular rapid weight loss combined with a reduction of the waist circumference, and most interestingly, the possibility to maintain over time body weight. When analyzing the impact of the three no pillars of strategy on weight changes, we have found that all the three factors were positively associated with the weight changes, but the most important predictors were dinner and bread. So, given these positive effects, we decided to expand the application of the full body in bed gym to a greater population. And so we involved 22 sedentary older adults in a study conducted in Padua who performed for 2 months the full body in bed gym protocol, starting from a limited subset of exercise of 10 movements repeated 3 times per week. And what we have found in these subjects has been an improved mental health and reduced level of chronic pain after 2 months of exercises, as well as a high patient satisfaction level and an excellent safety profile with no adverse events reported. But one of the things that was most interesting was the fact that these subjects, after 6 months, were asked if they were still performing the exercise protocol, and their answer were that they were still continue. Almost half of them were still continuing with the protocol, thus confirming the high tolerability and high adherence possibility in this protocol. So finally, another interesting aspect I would like to focus on is the fact that this exercise protocol involves also a cognitive and memory component, since we have seen that the total number of exercise is 50. So repeating all these exercises involves continuous recall and sequencing, thus activating some cognitive processes that can increase and support neuroplasticity. And therefore, this is another interesting aspect on which we will perform the future research. And so to conclude, we can say that the full body embedded gym, when combined with the free no strategy, could be a good instrument to try to fight against frailty and functional decline occurring with age, in particular for its effects on metabolic and muscle function, but also through the effects reported on quality of life and on cognitive aspects. Finally, we have no excuses to perform this kind of home-based exercise protocol, since it requires minimal equipment, and therefore involving and being engaged in this kind of home-based exercise can be a good strategy to try to reduce the future need for rehabilitative care. And so, thank you very much for your attention.